Aortic stenosis is a narrowing of the heart valve. The heart has 4 heart valves, and these are one-way valves that allow blood to go forward and not backwards. The aortic valve is one of the most important heart valves. This is a valve that opens and closes every time the heart beats to allow blood to go to the aorta and feed the rest of the body. As we get older, up to 5% of us will develop aortic stenosis, where the valve gets calcium buildup and it doesn't open properly. And that's what aortic stenosis is. The valve, instead of opening like this every time the heart beats, gets heavily calcified and is restricted in its motion and opens like this. So most aortic stenosis is asymptomatic until the valve gets tight enough where people develop symptoms. The symptoms of aortic stenosis are chest pain, shortness of breath, or lightheadedness and dizziness, and even frankly passing out. So when patients develop those symptoms and the aortic stenosis is severe, that's an indication to have a procedure to fix the aortic valve. Prior to 2012, the only way to fix this aortic valve was to have open heart surgery and replace it with a surgical aortic valve. Since 2012, the FDA has approved TAVR, which is a transcatheter aortic valve replacement procedure. And this is a way for us to replace the aortic valve, and in under 30 minutes, we can complete this procedure and patients don't have to have open heart surgery. TAVR is a relatively low-risk procedure, especially considering the alternative. And once you are symptomatic and have severe aortic stenosis, there's a 50% 2-year survival. So when you compare the risks compared to the 50% 2-year survival, yes, it is definitely a relatively low-risk procedure for a very, very severe disease.